When a payer audits your progress note examples, the rule is brutal. If it was not documented, it did not happen. Your progress notes are the only proof of the care you delivered, and the only thing standing between you and a recoupment demand. Good documentation defends an audit, supports continuity of care, and demonstrates medical necessity. Weak documentation costs you reimbursement. We will walk through the 3 core progress note formats, the mistakes that flag audits, and how a progress note template keeps your team compliant. So what is a progress note actually for? It tells the whole treatment team the patient's status, response, and care plan so any clinician can pick up the next session. It is your primary record in any complaint, lawsuit, or investigation, the documented account of what happened in the session, and it must support the level of care you billed, or payers will deny the claim and demand the money back. Here is where it gets expensive at the audit. A 9837 note, 60-minute psychotherapy that reads like a 30-minute session triggers a recoupment demand or denial. Documentation is one of the most common sources of compliance failures, and the gap surfaces on retrospective review. This is where a generic EHR falls short. A generic system gives clinicians a blank text box and hopes the right elements end up in it. Behave Health is designed to support structured note templates built around SOAP, DAP, and BIRP, with compliance fields enforced at the point of documentation. Behavioral health runs on 3 progress note formats. Let us break down all 3. SOAP, DAP, and BIRP. Each maps to a different setting and payer expectation. Format 1. SOAP. Subjective, Objective, Assessment, Plan. Subjective is the patient's self-reported mood and symptoms. Objective is what you observed: affect, behavior, mental status exam. Assessment is your clinical interpretation and progress toward goals. Plan is the next steps and interventions. SOAP maps cleanly to the medical model, which is why it satisfies most payer documentation requirements. Format 2. DAP, Data Assessment Plan. DAP merges the subjective report and objective observations into one combined data section. It is a streamlined alternative that reduces redundancy while preserving the clinical logic of the note. Many outpatient and community mental health settings prefer DAP for exactly that reason. Format 3. BIRP. Behavior, Intervention, Response, Plan. BIRP explicitly documents what the clinician did, the specific technique, and how the patient responded to it. That makes it well-suited for demonstrating medical necessity and treatment fidelity. It is especially common in residential treatment and intensive outpatient programs. Payers and accreditors look for specific documentation problems. These are the ones that flag audits. Identical or cloned notes across sessions are a primary audit red flag. Every session must reflect the actual encounter. Discussed feelings is not a documented intervention. Name the technique: CBT, motivational interviewing, DBT skills. Notes need service duration to support the CPT code, plus a documented screen for suicidal and homicidal ideation. A note with no connection to a treatment plan goal cannot demonstrate progress and cannot support continued authorization. Documentation requirements shift with the level of care. Residential needs daily nursing notes and weekly clinical notes that justify medical necessity for 24-hour care. Partial hospitalization and intensive outpatient focus on daily stability, group participation, and skill practice. Outpatient tracks symptom trajectory. Medication management documents response, side effects, adherence, and safety. This is where the right platform changes documentation. Behave Health is designed to support note templates at the point of care. Templates pre-populate session type, clinician, date, and CPT code, eliminating repetitive data entry. Structured fields for each section guide clinicians through complete documentation, with pick lists for affect and interventions. Risk assessment and treatment goal links can be required before a note is signed, helping prevent common audit errors. And duplicate note warnings help keep every note individualized the way good templates should. Your progress notes do not have to be the weak link at audit. Build them right at the point of care. See SOAP, DAP, and BIRP templates built into your workflow. Book a 20-minute demo at behavehealth.com.